In healthcare, we have a lot of concerns in a legal and ethical sense when it comes to marketing in our space that is not as common in other spaces. So, this particular training, I'm going to run through some of the more recent FTC cases. There's been quite an aggressive approach to pursuing healthcare providers and entities to make sure that we're ensuring safe and private information for our patients, to make sure that we're marketing in legal and ethical ways, to make sure we're reimbursing our staff when it comes to things like kickbacks or commission-based pay. We have to be very, very careful in healthcare, which is not so common in other verticals. Now, I do have to, of course, have a disclaimer here. I'm not a lawyer. This is not legal advice. I will share you my expertise in terms of everything that we've learned over the years related to healthcare marketing, but you should always be consulting with your legal counsel or a lawyer to ensure that you're getting the best legal interpretation based on some of the laws that I'll be talking about. So the primary concern that a lot of people have is HIPAA. It's actually very easy to get tripped up on HIPAA. When we're thinking about HIPAA, there's two main things that we're looking at. We are looking at personal health information and personal identification information. From a HIPAA standpoint, if we keep those two things separate, there is no problem. We have no concerns. It's only once you mix the health information with the identification information that we are opening ourselves up to the potential for liability. And from an electronic standpoint, this is pretty easy to happen. It can be something as simple as maybe your front desk person or a nurse is typing on the computer, they have a patient file pulled up and their screen is facing outward, or it's facing in some way that another patient walking by could see. That is a potential HIPAA violation. Maybe you have an email that's going to a patient reminding them about an appointment. There's nothing wrong with sending emails to patients, but we have identification information and health information in there together. So if that gets hacked, if that gets intercepted, then we have a breach that has to be reported. So to be as safe as possible, we're always trying to limit the mixing of PHI and PII. And I'll walk through some common scenarios or examples of where it's often better to be safe than sorry. Images is a simple one. These days, we're taking photos all the time. Maybe we have a staff party and we're taking a photo of all the staff, and then there's a patient in the background of the photo that we didn't notice. That gets uploaded to social media, celebrating the staff party, and then suddenly we have a HIPAA violation on our hands. So we have to be vigilant. We have to be cautious with things like that to make sure that staff are trained and that everyone's aware to always double check simple things like a social media post, and just making sure that there's no patient information indirectly exposed. There's no computer screens that people can see that might have patient information in the photo. So simple one, but an easy one to slip up on. Lists I bring up here because we get asked questions about it quite a bit. Maybe we have an email marketing list. Is that a HIPAA concern? No, it's absolutely not. If we've got an Excel file and that Excel file has names, phone numbers, email addresses, social security numbers, anything on there is just personal identification information. So we have no HIPAA concerns around an Excel spreadsheet, a list of patients that we're sending emails to or that we're sending newsletters to. None of that is a concern, unless we add a column that talks about their diagnosis or the healthcare services that they sought from us. Then that can become a potential HIPAA issue. Again, it's not a HIPAA issue unless someone outside of our organization gets a hold of the file or gets exposed to the file. A point of caution here, obviously most of the time we're not going to have a list that's going out for a newsletter that's going to have healthcare information on it. But we can make a simple mistake like naming the list patients, or naming the list, our facility, patients from our facility. Now I've got a potential HIPAA risk that I didn't need to have. So if we're going to send out like a newsletter list as a marketing agency or a marketing department, and we get a list from the provider, it should just say names for newsletters or newsletter list, right? As long as we don't have the word patient on there, then we don't have any potential for HIPAA compliance concerns. Even if someone broke into our email client and they hacked their way in there, that would not be a breach because there's nothing that signifies that that list is for patients. Reviews is one that's often kind of hard for providers to deal with because we want to respond to reviews, whether they're good or bad. If we get a really good review, we love to say, oh, I really appreciate you coming in. So glad you had a great experience here. We can't do that because then we're confirming or denying the fact that they've been in our care, even though they are publicly stating that they've been there. They've already, provided that information. As covered entities, we are not supposed to confirm or deny that case. Now, we can say general things. We could say things like, I really appreciate the time you took to leave a comment, or we always really work hard to treat everyone that comes to our facility well. We're always happy when people have a good experience. You didn't confirm or deny that that patient was in your facility, but you did respond to the review. So you can get nuanced with that and really work around the law. But again, you're opening yourself up to risk there, because how easy is it for just your social media manager, or maybe you've got an intern that you hired to respond to reviews, or maybe you've got a third-party marketing agency that has no experience with HIPAA compliance or healthcare marketing. So you open yourself up to risk by responding to reviews in a more personal way. Negative reviews are just as difficult. Often we want to respond directly to that negative review and do what we can to fix the problem. We can't. We have to usually have a templated response saying, unfortunately, due to HIPAA, we're neither able to confirm nor deny anything related to an individual patient's experience. However, we take all concerns very seriously. We want to make sure that anyone coming to our facility has the best experience possible. Please call us or contact us to address any concerns. That's about the best we can do with reviews. So as I talked about emails, yes, you can send email newsletters, you can email patients, you can send them SMS text messages. Just remember, you do need an opt-in. So they should be opting in to be able to receive electronic communications from you before you send them. Now, again, if they didn't opt in and you sent them communications, that's a breach of privacy concerns, but it's not a HIPAA violation. The HIPAA violation happens when you are mixing PHI and PII, and it goes out inadvertently to someone who is not a covered staff member. Website analytics is when it starts to get really tricky, and this is where the FTC has started to crack down. In particular, one of the most high-profile cases was Cerebral. So during the pandemic, you may remember Cerebral as a behavioral health provider of online treatment services, and they were sued by the FTC for, I believe it was $7 million, because they were not protecting the patient's privacy. So one, they didn't make it clear that they were using patient information to advertise. So that's kind of fact number one you want to be aware of, is your privacy policy should be really robust and your terms of service should be really robust, making it clear what the patient data is used for. And then the second piece of it was that they were submitting PHI and PII together to these healthcare platforms. So nowadays you can't retarget on Facebook or TikTok or Google. They banned it for healthcare providers, but back then you could. And so people were pixeling their websites and then running retargeting campaigns, which means that when someone came to the website, they would then submit that data back to Facebook, back to TikTok, back to LinkedIn. And that was a concern. Now, the concern was not that there was a website visit. The concern wasn't even that maybe somehow they were submitting patient names or patient email addresses. So on the back end of these platforms, you can upload what's called a custom list. And this custom list will have the name, email, maybe birth date, address. And what that does is it allows Facebook or TikTok or whichever platform to find that user's profile and then market directly to them. That's not a HIPAA violation because, again, there's just identification information in there. Now, what happened with Cerebral in particular was, you might be familiar with the fact that Facebook and Google reach out all the time and they're constantly trying to give you expert strategy advice. And those experts are really just sales reps trying to get you to spend more money on advertisement. But they'll call you, they'll talk to you, they'll walk through campaigns. And so what happened is a marketer from the Cerebral team was talking to this Facebook rep, and they were talking about a custom audience upload that was just personal identification information, but the cerebral marketer on the phone said, hey, this is a patient list that we're trying to target. Right there was the HIPAA violation. And of course, this is all recorded. Facebook and Google record all of these calls. The FTC got a hold of it through their subpoenas. And that was one of the things that they put in the charges against Cerebral, was that they had mixed PHI and PII. So they had a HIPAA violation just because that one person on the phone had taken all the identification information and suddenly made it a HIPAA violation by saying that they were patients. So this is what we have to be concerned about when it comes to our websites and our analytics. Another piece with analytics outside of advertising is your GA4 data or your Google Analytics data. So with Google Analytics, the programs record the IP addresses. Basically, if you look at heat mapping, if you look at screen recording tools, they all have some way that they're connecting an IP address to a website visit. Again, we don't have concerns here because it is just identification information, and we don't know who that person is. We don't know if they're looking for healthcare services, if it's a college kid doing a research paper, if it's a parent just looking, or a loved one just looking something up. So the FTC has ruled that IP address tracking for a website visit cannot be considered HIPAA concern because there is no clear way to connect it to a health concern, if that makes sense. Now, the difference in that is authenticated versus unauthenticated websites. So what I just said is true for an unauthenticated website. That means that you have a website that has no login. No one is putting in a username and a password to log into your site. Now, for some healthcare providers, hospitals, sometimes providers have payment portals that are directly logged into their site. So if they log in, that the FTC considers to be a patient login. It's basically a confirmation that they are utilizing services and therefore a patient of some kind. So now that's health information. So now their IP address is connected to a login, which is confirmation that they're a patient. Now we have a HIPAA violation. If that data gets sent to Google Analytics, if it gets sent to Facebook, if it gets sent to TikTok, whatever. Google Analytics is your only real question mark. So for Google Analytics, it's all aggregate data. You can't find an IP address in there. You can't see anything about individual users. It's just saying, hey, here's the total visits to your site. Here's the pages that they visited. So I am not aware of any concerns from the FTC or any other government agency with Google Analytics. Still, some hospitals have made the very conservative choice to even remove Google Analytics from their website if they have an authenticated website with a login. So that's a choice that you're going to have to make with your own compliance and legal team. I would not be overly concerned with the Google Analytics because, again, there's just no way to personalize that data. But there is obviously a connection between Google Analytics and the website, and Google is going to be able to see the fact that they moved to a patient portal, and so you do have potential HIPAA concerns there. For an advertising standpoint, again, we can't retarget, so you shouldn't have any pixel data on your website anyway. Generally, Facebook and Google will recognize that you're a healthcare website and so not allow your pixel or your tracking tool to receive any data. So they help you to be HIPAA compliant by blocking any data that might have been tried to be sent. With that said, we can still do certain things like a custom list. And if we take that personal identification information, upload it to the backend of these platforms, then we can market directly to those individuals. The only thing we have to be concerned about is if we name that list patient list, or if we talk to a Facebook rep or a Google rep and dropped the fact that it was a patient list. Now you have a HIPAA concern and a violation. So you just have to be really careful with a lot of this nuance in all of these situations. The last one that I often get asked about is online form fills. So HIPAA does have additional encryption and security requirements above and beyond a traditional website, even more so than like a payment platform. So if you have online form fills, which almost everyone does, they at least have a contact us form. The safest way to do this is just to have personal identification information, name, address, phone number. Do you want to call back? Yes or no, whatever the situation is. Now, the second you add a field for like a comment box where it just leaves it blank and they can put in whatever they want, now you have the potential for a HIPAA breach because they can put in their health information in there. They can ask questions about a health concern that they have. So transmitting that data to you, there's no concern there. Even though you're mixing PHI and PII, you're a covered entity, it's going to your staff, that's fine. Your concern is just the risk of liability. If the site gets hacked, usually the form fills are on the back end. Those can all be downloaded. Maybe someone can intercept the form fills. And so you're just opening yourself up to a higher degree of risk there than you would otherwise. Same thing if you have an insurance verification form on your site. That's a pretty clear indication of a health concern. And so any personal identification there creates a liability risk for HIPAA. So you really want to have a web developer or an IT specialist or a CTO that understands the encryption level requirements for HIPAA compliance to make sure that you aren't having any concerns there. Now you can see there's tons of nuance here and tons of things that your average marketing team, so a hire is not going to know, a regular marketing agency is not going to know any of these things. So you need to make sure that you're working with individuals that have been trained and educated on HIPAA compliance, whether that's your internal team or an external partner agency. Also, very important, if you're working with an external agency, you need a business associate agreement, a BAA in place, and that ensures that the covered entity is extended to all of your partners. So you're a covered entity under HIPAA with a BAA, then your marketing agency and other partners are also considered to be covered entities and have the same legal compliance risk that you do. Also, you're then allowed to share between to make sure that you have good communication happening. So if your team submits a list and it has patient information on it, as long as you have a BAA in place, that's not a HIPAA breach. There are a lot of illegal activities that we have to think about as well, in addition to HIPAA concerns. And a lot of those have to do with payments. So almost everyone's familiar with the Stark Law. If you're a physician, you cannot refer into a program where you have ownership or where a family member might have some ownership. So no referrals going to entities that you also own. Anti-kickback statutes. These are pretty important and can be interpreted quite broadly. So you can't get any kind of kickback, whether that's monetary or in-kind services or gifts that are in exchange for a patient referral. Now, technically, this only covers programs that are federally funded, so programs that accept Medicaid, Medicare, military insurance policies like TRICARE. So you have to be really careful there. Well, I always recommend that all entities, healthcare entities, should act in the same way. Just because you don't take federally funded insurance doesn't mean you should be engaging in kickbacks, because there are concerns around that, as I'll talk about in a bit. So one of the things in terms of a broad interpretation of anti-kickback statutes is incentivizing the patients themselves. So paying for travel to the facility, especially if you're paying for like an airline ticket. Now there is some potential to go pick patients up in a car or help with transportation for a drivable distance. That's usually not a problem, but you can't be paying for train tickets. You can't be paying for flights across the country. You can't be offering free services. If you offer free services, that's still considered like an in-kind or in-service kickback to the patient to show up for treatment or show up for services. So we want to be really, really careful about any kind of free offerings that we might have for patients that might incentivize them to come in. This goes for waiving deductibles and waiving copays. Now, again, if you're just treating the commercially insured or if you're a private pay organization, you could technically do this sometimes. If you're private pay, there's technically nothing from a legal standpoint here. However, your insurance contract will absolutely say that you cannot waive deductibles or copays, that you have to collect all patient responsibility. And the insurers will 100% go after you if you choose not to do this and they find out about it. There was a big lawsuit against Biomed from one of the health insurers when they found out that they were not taking the deductibles as a way to get patients into treatment and compete in the marketplace. You can't do that kind of thing. Sometimes providers think that it's helping patients, maybe there's some validity there, but it doesn't matter. It's still breaking the contract, and so you can be sued for breaking the contract, even if you are not in a situation where the anti-kickback statutes might apply. Commission-based pay is another one that has a lot of concern, especially within the behavioral health treatment space. So substance use in particular, as a subset of behavioral health, has a lot of extra laws. There was some pretty egregious violations of patient brokering and referrals and paying for patients and all this kind of shady stuff happening in the substance use treatment space for a while. So a lot of states have very specific laws. There are a number of federal laws that are very specific for substance use. But I mentioned them, and we'll talk about them in a second. If the government has concerns around paying for patients in one aspect of healthcare, then it probably has concerns around other aspects of healthcare as well. That doesn't mean it's illegal in other service lines, but it does mean that there's certainly a concern there. And so from a liability standpoint, do we want to take that risk where the government reinterprets a law or interprets a law more broadly, or just puts us in a place that we maybe don't consider the most ethical? So one of these areas is commission-based pay for outreach reps for healthcare providers. Sometimes it even kind of falls under the anti-kickback statute. We're incentivizing, we're paying for our internal staff to get more patients, to bring in more business, and that can be a legal concern. So my personal advice to all providers is to just pay a flat salary and give performance-based bonuses on a regular basis like you would any other staff. Who do you want working for you? Do you want someone that's really focused on maximizing their pay? Or do you want someone that really cares about your mission and what they're doing and then wants to be compensated well or compensated fairly for that? Usually it's the latter, at least as far as what I recommend to providers in terms of who they hire for outreach. Now, there's all these ways around these kind of legalities. You will see private equity firms in particular, they'll do some kind of really convoluted point-based system. And so since it's a point-based system and not directly or only related to new patient admissions, then it's legal. You'll sometimes see providers do changing titles. So I've seen providers every month change the title for their outreach rep based on their performance from the previous month. So today they're an outreach representative. Next month they're a VP of outreach. The month after that they're a director of outreach, and their title changes just commensurate with how they did the previous month. That's really walking a fine line there, even though it's technically legal. They've run that by legal. They've gotten approval. That's not something that I would recommend as a risk taking on. And again, who do we want working for us? People focus on revenue maximization, or people really caring about our mission that just want to be paid well and paid fairly. The latter is going to be better for most healthcare organizations. So I just tell providers to offer a flat salary rather than trying to mess with all this convoluted nonsense related to commission-based pay. So ECRA, the Support Act, so these are particularly related to substance use. ECRA was Eliminating Kickbacks and Recovery Act, and that was all about patient brokering and reimbursing for referrals, paying for plane tickets. So all of these concerns are part of the Support Act and ECRA, and technically relate specifically to substance use, but I always recommend that other healthcare providers kind of think along those lines, because if it's going to happen in one healthcare space, it might extend in the future, and that way we're kind of future-proofing our business. Outside of the legal implications, there are a number of ethical concerns that often come up in the space. One is conquest marketing. So conquest marketing is when you go to Google Ads and you bid on a competitor name. So let's say that I am Intermountain and I bid on John Hopkins as a search term, and then I advertise the same services that people are looking for. There's nothing illegal here. It's perfectly allowable. You'll see lots of verticals do this all the time. Walmart bids on Amazon, Amazon bids on Walmart, and vice versa. There's no problems there, but it is considered often an ethical concern. At least in the healthcare space, if you have a patient that's looking for John Hopkins, why do you have another provider trying to jump in there and say, looking for John Hopkins, call us instead? That's the kind of marketing you'll often see with conquest advertising. Again, legal, but a little bit concerning from others in the space. You might get looked down upon, you might get less referrals, you might just engender a bad reputation by doing marketing like that. Now, it is illegal if there is false or deceptive practices. And Evoke Wellness was a healthcare provider that just got nailed by the FTC about a year ago on this one. And so what the FTC said was that they were bidding on competitors' names, but then they weren't being open and honest who they were. So they would pretend to be the competitor. They'd have the website match what the competitor looked like, or at least the landing page. They'd have language on it. And then you would call Evoke, and Evoke would be obfuscating in terms of who they were. So they'd say, oh, well, thank you for calling our hotline, rather than saying, thank you for calling Evoke. And this way they would try to get patients that were going somewhere else to come to their facility. And so the FTC sued them, and they faced sanctions and penalties for that. So conquest marketing is something to be aware of. Third-party call centers is another one that comes up fairly regularly. These are legal in most states. Some states like Florida have special requirements around using a third-party call center. Third-party call center is a third party that you are hiring to gather inquiries, and then they sell them to you or they sell them to other providers. We can see the ethical concern here. So rather than someone who's trained in your organization, who knows you, who knows what you do, who knows how to help your patients or patients that need your services, you now have some random third party that who knows what their training is, who knows what they're saying on the phone, who knows what the quality control is, and this organization is just paying them for leads. That's generally frowned upon in the healthcare space. Some healthcare providers absolutely do it. I personally don't recommend it for that exact reason. You don't know what's being said to those patients. You don't know if they're getting to the right place. At the end of the day, we always want to put the patient's best interests at heart. And if we have some random third party generating inquiries and then making referrals, they're doing that for profit rather than what's the best fit for the patient. So not ideal. A good example of this is in senior care, A Place for Mom. A Place for Mom is just a lead generation site. And so what they do is they aggregate leads and then they sell them to senior care facilities. Big question marks around that. It's not illegal. They're not doing anything wrong technically, but certainly from an ethical standpoint, there's a lot of concerns there. Do we really want people calling some random third party and then that third party selling that person's information to a healthcare provider? Lots of question marks around that. Obviously, accurate communication is really important. And this is also why you need good training for your internal team. It's why you need good training for an external agency, or make sure you're partnering with an agency that understands all of this nuance. Because what you don't want to happen is some agency or some marketer coming in and then running conquest marketing because they've done it in all the other verticals they worked with, not realizing that there is really severe potential blowback from the healthcare community, from referral partners, if they see you engaging in practices that they might consider unethical, that might be more common in another space. As always, what's best for the patient? Is the patient calling some random third party and then getting their name sold to whoever is paying for that the best practice? Probably not. How do we put the patient's best interests at heart? That's how we should always be thinking about our marketing services. Even things like conquest marketing. If the patient's looking for John Hopkins, is it really in the patient's best interest for us to be jumping in front of them and then trying to get them to call us instead? Definitely a question mark and something that's worth discussing internally, regardless of whether there is specific laws regarding those behaviors. So legal and ethical questions. We've covered most of these, so I'll just touch on them in brief. Can we pay outreach reps on commission? Some aspects of healthcare you can, especially if you're doing point systems or if you're doing like some kind of convoluted title changes based on performance. But my personal recommendation is to avoid it because there are concerns with certain laws, especially anti-kickback laws, that we don't want to compensate people for patients. And again, who's better to hire? The person that really wants to be there or the person that's just trying to maximize their paycheck? Can we install tracking analytics on our website? Yes, you can install tracking analytics on your website if you do not have a patient login portal or some other kind of login portal that would then send information confirming that they are a healthcare patient. Now, there is that question on GA4 and Google Analytics. Generally, it's aggregating all the data there. There's no way to really see individual user case data, though obviously Google is sending data back to itself. So the most conservative hospitals that have a login will not have Google Analytics, but the vast majority of healthcare providers have Google Analytics, and I have not heard anything or seen any court cases saying that that is a concern. All of the court cases that you look at, all the concerns are really around marketing practices, around sharing privacy information that is then combined with healthcare information, so it becomes a HIPAA violation. Those are the biggest concerns that the FTC has shown to date. Another example that the FTC had was a marketing team had sent out postcards, and the postcards implied that they were a patient or that they were familiar with this particular facility. And so because that's not closed, you have the sense of PHI and PII being mixed, and so they got dinged for that. Can we offer free services to attract patients? If you are private pay, you can do whatever you want. But if you are taking commercial insurance, or especially if you're taking federally funded insurances, then you 100% have to make sure that you are not waiving deductibles, not waiving copays, making sure that you're not providing any kind of free services that might be seen as an incentive to come into treatment. So we really want to be safe around these practices. Can we cover travel costs? That's still a little bit of a gray area. So within substance use, you definitely cannot pay for flights or pay for long distance travel, but there is no law. We haven't seen any legal cases against providing transport by car, as long as it's a reasonable driving distance. So that's generally considered okay, at least as far as we've seen. Again, this isn't legal advice, but there are definitely concerns around kickbacks associated with free transport. So just be mindful that there is potential concerns out there. However, helping a patient get to care is generally considered to be a good thing to do in a lot of healthcare circles. And so we have not seen any legal concerns as a result of that. Can we target competitors' names on Google Ads? Yes, you can. Legally, there's no concern there. There is just an ethical question mark of if that's the right thing to do. Is that what is best for patients? Can we use third-party agencies? So there's definitely some question marks around third-party call centers, as I discussed, but I've actually had healthcare providers say, can we even use an external marketing agency? Isn't there a concern around kickbacks there? Doesn't that fall under any of these laws? And the answer is no. For marketing agencies, you're signing a BAA, so they're both covered entities, so you're allowed to exchange information, and there is a fee for service that has nothing to do with patients. Now, if you tried to enter a contract that said, hey, we'll pay you per patient, now you are breaking the law, because now you're directly incentivizing patient referrals. Whereas if your marketing agency is just running your ad campaigns, helping you with creative, running your social media, developing your website, those are contracted services that is not directly resulting from per patient fee. So there's no concerns with working with an agency in that sense. You're just contracting like you would with any other vendor. I would add that you should definitely make sure that you're using all of your own profiles. Is it your website? Is it your Facebook page? Is it your Facebook ad account? Sometimes agencies will want to use their own for whatever reason. I strongly discourage that because there are ethical concerns there, potentially sometimes legal concerns. You'll often see Facebook and Google want you to own your ad accounts on those platforms. They'll often specifically ask if your ads are being run on behalf of someone else. And so there's no legal concern there, but there is definitely a concern that there's a potential for abuse, but also you should own your own stuff. You should have transparent access to your own analytics. It should be your account that you're sharing with the agency, not the agency running an account on your behalf, because you want to own that data, you want to own that creative, you want to have quality control, you want to actually verify results. Are you getting the results that the agency says that you're getting? Can you look in the back-end analytics? So definitely always be thinking about how you're sharing your platform access with agency partners. It should be really open, it should be transparent, but there is no concern from a legal standpoint working with an agency unless you were to try to pay for referrals, which, as we all know, is illegal. One comment related to that would be third-party websites owned by you. So, for example, Eli Lilly, the big pharmaceutical provider, got in trouble with the FTC because they owned Prozac.com, and Prozac.com provided a lot of information around Prozac, but it wasn't Eli Lilly's main site. So it was a separate site that they owned. We've seen this a lot within the healthcare space where providers will try to have third-party sites that aren't labeled as their site. Maybe it looks like a nonprofit or it looks like an informational educational site, but in reality, it is owned by this other organization, whether it's a for-profit or a nonprofit. Now, there's nothing illegal there unless you're using deceptive practices. So the FTC will come down on you if you are saying, hey, you're contacting Prozac.com rather than contacting Eli Lilly. It needs to be on the homepage. It needs to be very visible that this is an Eli Lilly site. And if you are contacting the site, you are contacting them. Now, that's not actually what Eli Lilly got in trouble for. Eli Lilly got in trouble because they had a HIPAA violation. So they had sent an email to all these patients that had signed up for a notification service. And the internal staff member had accidentally put all of the email addresses into the CC field. And so everyone saw everyone else's email address, which, because it was a patient relevant email, we had a mix of PHI and PII. So the FTC was very upset about that. Even though it was one instance, it was a slip up by a single employee, the FTC still came down on Eli Lilly for it. So as I mentioned, they treat these things very seriously. So even if you have a third-party website that you're using, you still need to make sure that it complies with all of the same HIPAA regulations, all of the same healthcare communications, marketing, and kickback laws. And from my perspective, everything should be really upfront and clear that this is a website run by whatever your organization's name is. Because again, we want to think about what's best for the patient. Are we being open? Are we being transparent with the patients? Do they know whose website this is, who's creating this information, who they're contacting? All of that stuff is really important from a patient standpoint. So that's it. That is our overview of legal and ethical considerations for marketing within healthcare organizations. Like I said, there's a lot in there. Hopefully this gives you a good enough overview for the main pain points that we've seen come up over time, as well as some of the FTC cases that they seem to be most concerned about. Bottom line, make sure you have trainings for your staff. Make sure you're hiring people that understand healthcare marketing. Make sure any agency partners you have really understand healthcare marketing, because you do not want to end up in a liability situation. And you also don't want to end up in a situation where you are looked down upon by your community partners because you're not maybe running marketing in a way that would be considered ethical within the healthcare space.